This is Maza.
Hi, that's so nice to meet you.
That's Ryan.
Hi, how are you?
And Christina.
Hi, nice to meet you. Welcome to Jamaica.
Thank you.
Down here.
Hi, how was the journey?
Oh, it was fun. It was fun. We almost ran into a truck. We almost ran over two bicyclers. And we didn't kill anybody.
Initials, no, you were not that
Sorry, I'm listening.
Initials?
We can change tomorrow.
Hi, my name is Helen. I'm the neuromonitoring technologist for this team. I'm from Sarasota, Florida. I work with Biotronic, and I'm going to be working with Dr. Rachi for this mission.
Hi, I'm Christina Reagan Duncan, and I am the secretary to the board for Duncan Tree Foundation. My role today, or for this mission trip, is to be the logistics coordinator, and I have been helping with the whole planning for this particular medical mission. And I am looking forward to seeing everything happen, and I know that it will go great.
I'm Dr. Boachi. I'm an orthopedic spine surgeon at the Hospital for Special Surgery. I'm also the chief of the scoliosis service at HSS, and also the founder and president of the Foundation for Orthopedics and Complex Spine. So scoliosis and spine deformity has been my specialty for the past 20 years. And one of my interests has been training and education and professional development of individuals who are interested in pursuing careers in spine deformity surgery.
So I was trying to explain to Christina, eggs in Jamaica, it's not like eggs in the US. You can actually taste the flavor. So what we're doing now, we're having breakfast with the team. We're here at the Nutsford Court Hotel, which is actually a very nice hotel. Exceeds my expectations as to what the accommodations would be. And we are in about an hour and a half going to the ministry to meet with the minister of health. To say hello, friends and all, to let them know what we're going to be doing here and what we're planning to do in Jamaica.
I'm bringing the chief nurse, Dr. Jahene, to meet with you.
Good morning. Nice to meet you.
This is Dr. Boachi, who is a specialist surgeon.
I'm the old nurse.
Good to meet you all. Been reading a little about what you do. Welcome to the Ministry of Health.
Thank you.
This is Miss Timberlake.
You're Miss Timberlake. Nice to meet you. I was on a couple of conference calls with you a couple of years back. Nice to meet you.
This is Christina.
Nice to meet you, Christina.
Hi, Dr. Boachi.
And how are the girls? Do we know how they're doing? But I want to see how
Oh,
they're
if
doing.
they're okay and all of that. there. So you're going to go to the facility today. You bet you did.
Yes.
Great. I'm telling you, we're more than happy, more than grateful. You know, I tell people all the time, the Ministry of Health, the government alone can't do, and we really have to partner with others to making things like these achievable. You know, otherwise what would happen too when you think about the end users, which are the people, you know, that's where your mind, that's where the thinking has to be. So once again, I express appreciation on behalf of the ministry and the Minister of Health.
It is our pleasure. What possibilities are on the horizon in terms of getting more aid, whether it's from the World Health Organization or from various governments around the world?
Well, certainly we have been in dialogue with a number of aid agencies in coordination for health, ensuring that their priorities are aligned with our priorities. Our priorities are aligned with theirs, certainly, so that we can get more, you know, benefits and aid for health. I know equipment and supplies is a big challenge for us here.
This is from a budgetary point of view, or I guess that's what it is, right? It's money.
Right. When you really look at it, it really goes down to the dollar value, the budget, the resources that we have.
Maybe 100 different groups that come down to Jamaica once a year, 4 times a year to dispense free health care. So you have a lot of these missions like ours, and you might have, you know, 20 groups going to one parish and maybe 5 groups going to another parish. So the idea was to coordinate efforts so that we can distribute the philanthropy, so to speak. Are you Denzel?
Yes.
Hi, Denzel. How are you?
Good to meet you.
Nice to meet you. Very nice to meet you.
Thank you.
Christina.
Denzel, nice to meet you.
Miss Timberlake.
Hello, I'm Abigail Timberlake.
Denzel, nice to meet you.
Mrs. Maza.
Hi.
Dr. Boachi.
Hi, Denzel. How are you?
Fine, nice
Washington?
Well, he
No?
wishes he was me.
Very pleased to have you. I have read your work and we're very happy to have you visiting Jamaica presently and your intended work while you're in Jamaica. We have a great challenge in Jamaica dealing with healthcare in general, and our own vision for our people in terms of quality care. But we're very happy when, you know, especially in the area of orthopedic, where we are able to get this kind of support. We are aware of the cost. There are times when, you know, for poor families, they're just not in a position to take on the surgery that is required. I noticed that your foundation has been focusing on the underprivileged persons who, whether it is Jamaica or in the US, and we really want to thank you for your own initiative in getting this foundation going. I know that Nikisha Orton, she's out of Montego Bay. She'll be one of the beneficiaries of surgery tomorrow, and I know that it will be, you know, well received.
I think this is a very good initiative and a great partnership, because this is how things ought to be done. The government can't do everything. You know, you have pressing needs in public health, basic education, infrastructural development. So when it comes to specialty care, it becomes a huge burden. And even in the United States, we're still grappling with the cost of health care, and we still don't have a solution. The Supreme Court is debating this whole healthcare issue
yes,
this week, and it's going to go on to
Obamacare program.
And so nobody has a solution to the ideal healthcare. You know, governments in the West and Europe have all tried all forms of healthcare, but eventually it's going to be a blend of private and government initiatives. You know, and that's how it's going to work. And there's always going to be a cost factor in everything that you do. Even someone, they say, oh yeah, I volunteered and I did this. I didn't do it for free. I've left my office
Somebody
today.
has to pay.
And I'm paying my office. You know, so there's always a cost factor, but the question is how much can you give back?
Yes. Okay. And we look forward to the, building this relationship. If there's anything that I can do as minister, feel free. Because we know what you're doing and we're happy.
I'm happy to be here.
Yeah.
And I'm happy to make it Jamaica. There we go.
Very good.
Very good.
Pleased to meet you.
Pleasure.
Nice to meet you.
I'm Margarita Golding. I'm the Special Envoy for Advocacy at the Southeast Regional Health Authority. I have been the point of contact for pretty much since Dr. Borsing passed it on to me in January. I'd like to welcome each and every one of you to our country first of all. I'd like to especially welcome Dr. Boachi, who will be doing the surgeries tomorrow. Also, I'd like to introduce you all to our SMO, Dr. Borsing, our CEO, Mr. Boyd, and of course you all already know Dr. Campbell first.
Look forward to the idea that our plan to not only to do the surgeries but also to make the program self-regenerated, because we have an active orthopedic postgraduate program through the university, and we have residents who rotate through KPH. I must say that Dr. Neil is really the first surgeon who has really taken on single-handed scoliosis, and he's doing very well with that. Of course, the challenges, I'm sure maybe you're aware of the challenges that we face in terms of supply of the hardware. It's very expensive, operating time, we have other equipment issues also.
I think you're way ahead of the curve compared to other things that I have been.
Within the orthopedic program per year, I don't think they did more than 2 per year. Two per year.
But they're not all
From Jamaica? Yes, they're all from Jamaica.
We discovered that spinal cord monitoring wasn't a core skill here in Jamaica. And so that's why, Lindsay's here, right, through Dr. Bawachi and his organization to provide that support for the 2 patients tomorrow. But as much as Duncan Tree can help facilitate getting that program up and running so that that will become a core skill, where we could possibly have nurses, 1 or 2 nurses per year, do a fellowship or some kind of training program.
He's interested also to train persons to carry on the work.
Awesome. You know, the burning question I have, because I know that the brain drain has been an issue for the last 30-something years or more. Why do you stay in Jamaica? Why are you still here? Why didn't you go to UK or Canada or US or somewhere else to practice your craft?
Many years ago when I was in the private sector, I observed some problems at one of the hospitals. And I tried to assist a gentleman, a janitorial staff with a broom, fix the problem. And I said to myself, it's really bad when you have a hospital suffering a problem for which they couldn't manage, and it took somebody else who doesn't even understand why the problem occurred, but just knows that if I do this with the broom, the problem was solved. And so as a result of which I came here for 3 years to help. I've been here for 12. And the one underlying thing that I would say to anyone, a life without service is not a life worth living. We are put here on this earth for that purpose. Not for riches, not for fame, not even for certification or education, but it's to help others. And therefore, what I found in help is a place where if you want a challenge, if you want to serve, then this is the place that the opportunities are.
Are you ready? 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 Are you ready?
Presentation is coming all the way from.
Are you ready? Are you ready?
Yes.
When the roll is called up, I'll be standing taller to face the darkest and the hardest of times. We'll be taking care of all the children thereof. But if it's required, we'll be on the front line. You can call me by my name. I am ready to roll. Once the rules remain the same, how the story's been told. Call me anytime, never cop out. Lioness is on the rise, don't you ever have doubt. Never say never, willingness forever to fight and be strong. Once it's for better, I'll write every letter and moving right along. And I'll roll with the punches, accept changes, work with the formula, do what I have to do, and call me by my name. I am ready to roll. Once the rules remain the same, how the story's been told. Call me anytime, never clock out. Lioness is on the rise, don't you ever have doubt. When you are willing to serve, we have room to observe, to see if you can walk the walk you tell. Let me give you my word, my voice must be heard. Bravery is a piece of my heart. Call me by my name, I am ready to roll. Once the rules remain the same, how the story's been told. Call me anytime, never cop out. A lioness is on.
What is that about?
Yeah, and then we got kicked out of town.
I'd like to introduce our Minister of Health, Dr. Fenton Ferguson.
Thank you very much, Ms. Golden, our chairman of the Southeast Regional Health Authority, Mr. Stanley Shirley, our regional director, Mr. Fox, leaders of the Kingston Public Hospital present here this evening, the CEO, our SMO, and I'd like to especially welcome the Duncan Foundation team led by Ms. Duncan, and we have among that team this year Dr. Boachi from Ghana, world-renowned orthopedic surgeon, and we are very, very happy to have him in Jamaica at this time. I believe that the work of the foundation is well known. And we are happy to see that this foundation is led by Jamaican. And not only the fact that it is led by Jamaican, but the fact that they have made Jamaica a priority. And I am very happy as minister to be associating with you. I had the privilege of meeting a number of the members at the ministry yesterday. But when I heard of this small function being planned, I said I had to show my face. But I'm also happy to know that we have medical technology, this team that have been making a contribution in terms of valuable donation to the activities that have taken place. And it is to that extent that I'm extremely pleased, and on behalf of the ministry, I want to thank you for what you have done. Once again, let me congratulate you. We wish the best for your foundation, and as a country, we would want to know that we are always in a position to support your foundation, and we look forward to your return. We are SMO and other members of staff. I want to congratulate you, and I look forward to continuing the work that you have started. Duncan Tree Foundation, coming out of the Southeast Regional Health Authority, signed by Chairman Littleton Shirley, Regional Director Donald Ferguson, Chief Executive Officer of KPH, Godfrey Boyd. I would like to make this presentation to Duncan.
I'm speechless. I want to thank the minister for taking time out of his busy schedule to be here tonight, and we're very grateful for the support and for the help that we got to bring Dr. Bawachi here and his team, and for Medtronic's donation to get cleared through the customs so that we can help Nikisha Houghton and Monique Gregory get the care that they deserve. So we're very, very happy to be here. And I have a lot to say, but I'm going to try to keep it brief. I want to thank Dr. Kirk Campbell, because without him, we would not have heard about Nikisha Houghton. He's from Montego Bay, and he went to the only high school in Jamaica.
That's what he told you.
But I'm going to ask the Duncan Tree team to please join me, because a lot of hard work, a lot of hours, a lot of phone calls, a lot of conference calls to make this happen this weekend. I want to thank them. And Dr. Bawachi and Maza and Ryan and Helen, if you can also join us. So I'm dedicating this certificate of appreciation to all of you. And believe it or not, we met Dr. Bawachi about 3 months ago. And it was very interesting circumstances that led up to the meeting. But we knew that we needed him. And God arranged it. And it's been an amazing pleasure that someone who is so talented and gifted possesses such humility and has such a strong faith in God and understands that without God, nothing is possible. So I want to thank him. We had a sleepless day yesterday, but he wanted to party. And Maza, you're such a treat. I want to thank you for, you are, believe it or not. And I still want to go shopping in Ghana, by the way. I'm waiting, okay? Miss Sheila, I don't even have words to describe how much I love you. I think I loved you the first time I laid eyes on you. How's that? Such a humble, powerful woman of God. And I'm very grateful that she doesn't think it robbery to spend her time with us. Denzel's a new addition to the team, and I'm looking forward to working with him. I'm glad that, actually, I told him 2 days before an event we had that he had to come, and he bought tickets to fly up from Florida. Unfortunately, he didn't make it, but we'll find another use for those tickets. Yes. And Ryan. So Ryan had a couple of incidentals with his passport, but somehow I said to Ryan, don't worry, it's just a test of your patience and your perseverance, and you're here, right? And so the next time you come, this is his first time in Jamaica, Maza, Dr. Bawachi, and Helen, and we all, we've been communicating by phone and email. So thank you so much for making time to come down to Jamaica to be part of helping Monique and Nikisha. I know I already thanked you. I want to thank you again. And he's always smiling. I don't know what's behind that smile. I don't know. I want to thank Christina. And actually Lorena, I have to get to you too. But Christina, she's my right hand. She's my boss actually. So just make sure it's all clear. She's the boss. And everybody knows it. And I have 4 daughters, but she's my main Jamaican daughter. Like she used to do the bogle when she was 3. And she now gets a chance to visit the place of my birth and spend some time on the North Coast tomorrow. And she's probably not going to want to leave, right? Okay. And Lorraine Lou, she's Jamaican. Come here, Lorraine. Come here, now, put the camera down now. Lorraine actually came to us through Kirk Campbell. They work at Mount Sinai, New York. And She was introduced to the foundation right before we went up to a big event for NBC, Connecticut in Hartford, and spent 2 days, 2 8-hour days, talking to people about nutrition. She's a dietitian by training, and helped us plan the event we had recently, and contributed a whole lot. And she said, you know what, Vida, I really want to come on the trip. I really want to meet those girls because I really want to see the faces behind this mission. And we're very grateful that you did that. So thank you. Thank you. So again, on behalf of everyone that participated in this trip, the sleepless, Dr. Boachi, solitary confinement, is that what you said? But tomorrow, let me tell you, when you go up to Tryon, you're not going to want to leave Jamaica. And Dr. Neil, I'm sorry. I have to say something about you. I'm sorry. Dr. Neil, as we talked about earlier, the circumstances under which we met were a little bit bumpy at first, but I think we've established the fact that we're going to be best friends for life.
We gotcha.
We gotcha. And I have to acknowledge Medtronics. Medtronics, they donated over $50,000 worth of equipment, the implants and the instrumentation, and they paid for the shipping. So they deserve a round of applause as well. And Miss Golding and Marita, I love you. So thank you, everyone. Thank you so much for coming tonight. All right, good night. Thank you.